We are right now in
The
negotiations.
CBO has not
for
agreed to that. The CBO
No,
doesn't say that. And it's just the
that's
opposite.
CMS
So you're saying
data.
the CBO and independent agencies that validate the costs are wrong?
That's
Okay, so let's
actually
just focus
raising-
on the cancer drugs. Why aren't we negotiating those,
Well,
bringing those down for families? Why
Why
does the bill exempt those?
Kennedy Jr. claims to fight Big Pharma while supporting a bill that shields the world's top-selling cancer drug, $175,000 per year, from Medicare negotiation. When asked about rising premiums and costs for seniors, Kennedy can't answer basic questions about his own agency's policies. The clash gets intense.
In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on Big Pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed Big Pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the hype with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo and Darzalex, the three top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on Big Pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions, and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. What we found is that there are actually, the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations.
The CBO has not agreed to that. The CBO doesn't say that. And it's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
That is CMS data.
Okay, so let's just focus on the cancer drugs. Why aren't we negotiating those, bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure that provision in the bill, of the one beautiful bill, but the—
You're not sure of the provision, the negotiation provision, and how exempted
for
cancer
Keytruda?
drugs? Your agency is responsible for that negotiation, and you don't know about it?
I know that we're negotiating in the MFN
Let me ask
negotiations.
you this, Mr. Secretary. Let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking about the rate?
They are going to pay $15 more than last year, up to $50 a month. Now, let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to Dr. Oz
that is about,
I think it's
they're supposed to increase about
16%.
11.6% or $21.50 more each month. And again, last time we were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. You know, next year, seniors and families are facing higher healthcare costs across the board. 23 million people on Medicare with a standalone Part D drug plan could see their premiums rise to $50 a month, up from $35, because the Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6%. to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims it is lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
I mean, I'm already doing I'm already keeping costs down.
What are you doing to keep costs down for seniors, knowing that these costs are going to be increasing?
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history of a complex regulation by an HHS secretary. A congressional budget office has said that that's brought premiums down by 5%. As the congressional budget office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering
for helping
costs.
seniors. Does it impact seniors?
Does it impact?
Come on. Let me just stop here.
I
My
didn't
time
hear
is
what
running
you
out, so
said.
I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
I didn't hear your question.
This confrontation between Senator Catherine Cortez Masto and HHS Secretary Robert F. Kennedy Jr. exposed the gap between Kennedy's populist rhetoric about fighting Big Pharma and the actual policy consequences of the Republican healthcare legislation he supports. The exchange revealed either a troubling lack of knowledge about his agency's core functions or an unwillingness to acknowledge policies that contradict his public positioning. Cortez Masto's opening salvo was devastating precisely because it used Kennedy's own words against him. By quoting his pledge of no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices, and putting American patients first, she established a standard by which to judge his actual record. Her immediate pivot to the big, beautiful bill that shields Keytruda, an $18 billion cancer drug costing patients up to $175,000 annually, from Medicare negotiation created a stark contradiction between rhetoric and reality. The senator's specific focus on cancer drugs was strategically brilliant. These aren't abstract pharmaceutical products, but medications that literally determine whether patients live or die. Keytruda, Opdivo, and Darzalex, the three top-selling cancer drugs, were widely expected for Medicare Part B negotiation, but are now exempt from negotiation for at least several additional years, if not permanently, due to the Republican legislation Kennedy supports. This exemption represents billions in continued Medicare spending and forces families into crushing debt or to forego life-saving care. Kennedy's defense that the IRA's Medicare drug negotiations were poorly structured and actually have ended up raising the cost for Medicare was a remarkable claim that directly contradicts multiple independent analyses. His citation of CMS data to support this assertion went unchallenged in the moment, but his inability to explain why cancer drugs specifically were exempted from negotiation exposed the weakness of his position. When Cortez Masto pressed on this point, Kennedy's response that it's part of the MFN negotiations and I'm not sure of that provision in the bill was particularly damaging. He was defending legislation whose specific provisions he couldn't explain. The senator's incredulous response, "Your agency is responsible for that negotiation and you don't know about it," captured the fundamental problem. This wasn't an obscure technical detail, but rather the centerpiece of the administration's claimed drug pricing strategy, and the HHS secretary couldn't articulate how it works or why cancer drugs were carved out. The exchange on Medicare premiums revealed even more troubling knowledge gaps. When asked what Part D enrollees would pay next year, Kennedy said it was in debate, when the actual answer was a concrete $15 increase to $50 monthly. When asked about Part B premium increases, he simply said, "I don't know," despite an 11.6% increase, $21.50 more per month, representing one of the largest single-year increases in decades. These aren't projections or estimates, but actual finalized numbers that the HHS secretary should know, cold. Cortez Masto's point that Kennedy couldn't answer basic questions, the last time he appeared before her, suggested a pattern rather than an isolated incident. Her enumeration of the consequences, 23 million people facing higher Part D premiums because the Trump administration cut federal subsidies, Part B premiums jumping 11.6%, painted a picture of seniors facing higher healthcare costs across the board, under an administration claiming to lower them. Kennedy's response that he's already keeping costs down through the Program Integrity Bill, and citing a Congressional Budget Office assessment of 5% premium reduction, seemed disconnected from Cortez Masto's specific questions about Part D and Part B increases. When she asked directly whether his actions impact seniors, Kennedy's exasperated "come on" suggested he felt the question was obvious, but his inability to provide a clear yes or no answer reinforced her criticism. Cortez Masto's closing statement, "You can't answer the questions," about the very agency you have oversight over, and that controls the levers to lower costs for seniors, cut to the core issue. Either Kennedy doesn't know critical details about his agency's policies and their impact on beneficiaries, or he knows but won't acknowledge that those policies are increasing costs for vulnerable populations, despite his rhetoric about fighting for patients.